Surgical assisting, prep to post-op, post-operative patient care and OR maintenance. Post-operative care and the surgical assistant's role during this important phase cannot be overemphasized. Caring for the patient during the immediate period after anesthesia involves diligent observation and possible patient intervention, as the surgical procedure will not be effective without a successful recovery. The endotracheal tube ties should be loosened and the cuff partially deflated to prevent tracheal slough. Once the patient is awake enough to swallow, the cuff must be completely deflated and the endotracheal tube gently removed. The patient's jawbone and reflexes are other indicators that the patient is waking up and extubation is close at hand. Failing to extubate the patient during this critical period may result in the animal chewing the tube in half and possibly choking. Monitoring the patient is crucial throughout the recovery process. When the patient is transferred from surgery into a recovery area, pay special attention to the patient's body temperature, pulse quality and heart rate, blood pressure, CRT, and respiratory rate. Any deviation from normal vital signs could indicate internal bleeding, anaphylaxis to drugs given perioperatively, or reduced anesthetic clearance from the patient's system. You should immediately alert the veterinarian to any signs that the patient is not recovering as expected. The patient should be kept warm after surgery. Anesthetic agents cause a drop in body core temperature, and removing the patient from the warming pad on the surgery table can cause the body temperature to fall significantly. Your continued monitoring should proceed until the body core temperature is normal and stable, and the patient is able to maintain itself in a sternal position. This posture is a good indicator that most of the anesthetic agent has been cleared from the patient's system. Although the residual effects of anesthesia, including ataxia, drooling or nausea, and transient unconsciousness, may persist for several hours. Be sure to evaluate the incision during this period. The surgeon may ask you to apply a cold pack to the surgical site during recovery to prevent bleeding, swelling, and discomfort. The surgical assistant should also evaluate the patient for pain during recovery. Notify the veterinarian if the patient seems especially uncomfortable, understanding that vocalizing may be an effect of anxiety and disorientation after the administration of anesthetic drugs. Pain has been proven to delay healing and suppress the immune system, so your observations are important to a successful recovery. When the patient is able to stand, the assistant should walk the animal outside to urinate and defecate. The bladder may become quite full during a long surgical procedure, especially if IV fluids are administered. Allowing the patient to eliminate will relieve discomfort, not to mention avoiding potential messes in the recovery cage, which can be a source of infection. At this point, small amounts of water should be offered, followed by a very small meal, and discontinued if there is any sign of nausea. The veterinarian will help determine when reintroduction to food and water should begin. In closing, a few comments should be made regarding the operating room. The room should be maintained to the highest standards of cleanliness. Most hospital-grade disinfectants and cleaners will very adequately disinfect the floors, tables, and other surfaces. A regular maintenance and cleaning schedule should be followed to help prevent surgical infections from occurring. Access to this room should also be limited to those on the surgical team. Equipment located in the operating room should be maintained in good working condition, including the surgical light to provide good illumination of the surgical site, an electrosurgery unit used to cut and cauterize tissue and blood vessels, and a suction unit to evacuate blood and other fluids during surgery. Proper cleaning and maintenance of the operating room and surgical equipment will help avoid potential problems in subsequent procedures, ensuring patient safety.